Your parents, grandparents, or other senior in your life is getting older. What do you do about it? What do you look out for? And how do you plan? Let's talk about it today. Hi, I'm Tracy with Village OT. I'm an occupational therapist who works with individuals who have had illness, injury, or disability and help them live as independently as possible. The concerns I'll address directly today are falls and unsteadiness, confusion or forgetfulness, social isolation and loneliness, and hygiene concerns, including urinary incontinence. Aging can look really different from person to person. It isn't uncommon for someone to know somebody who worked well into their 80s or somebody who was doing their own yard work until they were in their 90s. We hear a lot of really inspiring stories like that, but on the flip side, there are also people who started getting ill the second they retired, or they even started showing signs of a chronic illness well before that in their 40s or 50s. Because of these variabilities in the way people are aging, it can be really isolating if your parents or grandparents are aging very differently than that of your friends. And it can feel like you don't have anybody to talk to if your friends aren't going through the same thing that you are. There are a number of things that can impact the overall aging process. One of those things is a person's activity level and their health over the span of their life. Another thing is their socioeconomic status and their access to resources such as senior services, Meals on Wheels, or specialty physicians. And the last thing that can really impact a person in the way they age is the trauma that they've experienced. If they've had a loss that's really significant to them, such as a spouse or a child, or even a sibling that they spent a lot of time with, all of those things can really play into the way somebody is aging. If you're starting to have some concerns about your aging loved one and you know that they aren't having the same concerns that you're having, it can be really difficult to initiate a conversation with them about that. So hopefully in this video and throughout future videos that I post, you'll get some good tools and tricks for helping you manage those conversations and hopefully help your loved one stay as healthy and independent as long as possible. Sometimes when family members try to talk to the primary care provider of a senior in their life about their concerns regarding their function or their symptoms, they'll automatically get a prescription for maybe an antidepressant or some other medication that addresses the symptoms that they're seeing, or they'll just automatically recommend that that person be admitted to an assisted living facility or a nursing home. And for a lot of people, that doesn't feel quite right. It feels like there should be some other resources or options available before we jump into something too extreme. So let's go into a little bit more detail about some of the concerns that we talked about earlier. And one of the main concerns that a lot of people have regarding a senior staying at home is falls or unsteadiness. Now, sometimes falls are described initially as a little bit more controlled, such as I slid forward out of a chair or I lowered myself to the floor. And a lot of people don't think of those as falls because they didn't result in an injury. But when that's happening, it tends to be inevitable that there will be a big event shortly after that that does result in an injury that can cause a lot of life disruption. Falls don't just happen without a reason, so unless there's a really significant excuse for why a person may have fallen, such as something being left in the middle of the floor where it shouldn't have been and the person tripped over it, we need to investigate a little bit further and see what's actually causing the falls. Falls can often be caused by a medical issue or a medication instability. With medication issues, we see medications such as antihypertensive medication, which is medication for high blood pressure, and those can cause orthostatic hypotension, which is simply low blood pressure or blood pressure that gets lower once you stand up. And what that often looks like is a person stands up and they feel a little bit dizzy, but what I see some seniors do is instead of waiting on the dizziness to pass or sitting down, they'll simply try to rush to get to wherever they were headed, and that can lead to a fall. If you think that you're experiencing low blood pressure when you're standing, the best thing that you can do is simply to test that. And you can use just a standard blood pressure cuff like this if you're measuring yourself, or you can use one of the wrist cuffs. It's always better to have a manual measurement, but not everybody has somebody else available who can measure it for them. So something like this will work just fine for the purpose of just gathering the information to have for your primary care provider. You'll want to spend about 5 minutes at rest in a seated position without anything stressful or strenuous going on. So you don't want to have a stressful conversation with your significant other or be watching something really stressful on TV when you're about to measure your resting blood pressure. You'll measure your blood pressure with the cuff and get your initial measurement. Then after that, all you need to do is leave the cuff on your arm or your wrist, simply stand up and retest. See if those numbers are significantly different, and if you see a pretty big drop, it would be helpful to test this a couple more times at different times during the day or on different days to see if you are having a drop in your blood pressure consistently when you're standing. Some depression medications can also have a sedative effect, which can impact the level of alertness a person experiences when they are awake, and that can contribute to a fall risk as well. Also, diabetics are at an increased risk for falls, obviously because of blood sugar instabilities, and we just want to make sure that those insulin levels stay steady throughout the day. Now, if you're experiencing any of those symptoms that we just talked about, the best thing that you can do for yourself at home is to get as much information as possible. If you have diabetes, you want to make sure that you have a good log of your blood sugars and make sure that you notice when those sugar levels are up or down, and that way you can chat with your physician about them. Falls can also be caused by a general debility or a lack of activity. The less we use certain skills, the more likely we are to lose them. And we see a lot of debility, especially in the Midwest over the winter when the weather is more harsh, people are staying inside and just generally not getting as many steps in. We'll start to see more falls during that time period because people are just not as active. And when we aren't active, we lose the skills that we have. If you know that this is one of the reasons you are seeing some unsteadiness or balance concerns, you can usually get into an outpatient facility for a fall or balance assessment pretty quickly. You just call up, you tell them that you are seeing some unsteadiness and you would like to be assessed, and they can get you in with a physical or occupational therapist usually pretty quickly. And to get these appointments, you don't have to see a physician first in most states. But if you call the facility, you ask for an appointment, they'll let you know what you need from your doctor if you need anything at all. A good therapist will assess some of the vital signs that we mentioned earlier, such as heart rate, blood pressure, and oxygen levels during different activities, and see if any of those symptoms are impacting your balance. If the therapist that you see in outpatient indicates that your balance maybe isn't your biggest issue, it's always good to follow up with your primary care provider for a medication review and to review your symptoms with them. If you can't get into your primary care provider in a timely way, say within 1 to 2 weeks, you can check to see if you have telehealth options available to you through your insurance provider. You may also be concerned about forgetfulness or confusion. This is another issue that you can request a safety or cognitive assessment at an outpatient facility, and that can be done by occupational therapy, speech therapy, or even both, because both disciplines do look for different levels of functioning and assess for different things. I always love to get a therapy referral early when somebody is experiencing forgetfulness or confusion, because even if the person sees their primary care provider, they may be referred on to a specialist such as a neurologist, and it can take 3 to 6 months or even longer to get into one of those types of specialists. If we can get a therapy referral early on, we can start intervening early before things go downhill too much and make some early recommendations that can help slow the decline of certain conditions. Therapists are often a wealth of resources and may already be working with a specialist who is closely suited to the needs of the person you're concerned about. Additionally, therapists can make recommendations regarding extra help if a person isn't safe to stay at home, and they would be able to plug you in very early with any kind of home care that might be needed, whether that is temporary or something that might be needed long term. Social isolation and loneliness are other concerns that I hear from a lot of family members of seniors. And oftentimes a senior is retired and no longer working while the members of their family are still working and in school. And so they have a lot of social isolation during the day and aren't getting the same cognitive and physical stimulation that they got when they were leaving the house more regularly. When we don't have a lot of social interactions during the day and maybe don't have a reason to leave the house, we'll start to see some physical and cognitive decline from that lack of activity that was previously normal. Some seniors are no longer driving or may have nervousness as relates to driving, and that can cause some difficulty getting out of the house during the day. Unfortunately, these seniors may also live in a more rural environment where public transportation is not readily available, and that can also contribute to social isolation. The tough thing about social isolation is that people don't always want to address it. They may just be fine staying at home watching their regular shows or completing their regular routine, and they just don't want to get out. You can always encourage volunteerism, involvement in a church, or even connecting with someone via care.com just for a little bit of company. But overall, we can't force somebody to leave the house if they don't want to. So it's really important to dive in and see if a person isn't leaving the house because they don't want to, or if it's something a little bit deeper because they're afraid to drive or they don't want to bother anybody to come pick them up to take them somewhere. I grouped hygiene and urinary incontinence together as concerns that people have regarding seniors, but they may be entirely separate issues. Sometimes family members of senior citizens will tell me that they're starting to notice that their family member is having a bit of an odor and they're concerned about what's going on. For some seniors, the issue is a matter of access. They may have an older bathtub or a big lip to their shower and they're unable to make that step to physically get into the shower like they used to. So it can be something like that, or even just the balance once they get inside the shower. Some people are really nervous to be standing up with a wet floor without anything steady to hold on to, so that can be part of the concern. And you can always just ask them about that and see if there's anything you can immediately identify as a problem. Another issue related to balance is if a senior is having difficulty reaching down to their feet, it can be tough to be very thorough when cleaning. Another issue with bathing is some seniors have a lack of range of motion or mobility in their shoulders, their neck, or their spine that impact them from being able to reach very far, especially to clean their backside or to do any of those movements without a lot of pain or impairing their balance. If you find that your loved one is having a lot of bowel or bladder accidents, there are some things that can be done to help this. Pelvic floor therapy from a physical or occupational therapist who practices that specialization is an option. There are also medications that can help with incontinence, although there are also medications that can be causing incontinence. So it's really important to follow up with your provider and let them know the concerns related to bowel or bladder incontinence. If you've asked your loved one a few questions about their hygiene or their incontinence, and you're not seeing any real straightforward answers as to what might be going on, I would go ahead and get a referral to an occupational therapist and see if you can get an evaluation. They can usually take a look and see if there's anything that they can recommend as far as therapy goes. And there are a number of pieces of equipment that we can recommend for bathrooms, including the shower, the toilet, and even equipment for helping with the toileting tasks itself. And those things can help make that process a little bit easier and improve the overall hygiene. I plan to do more videos in the future that will cover some of the different equipment available for different sizes and types of bathrooms and different setups that can help somebody maintain their independence. So if that's something that you're looking for more information on, I would really appreciate if you would like and subscribe, as well as turn on notifications for my channel so you can make sure that you don't miss those videos. All of that being said, you realize the senior in your life is needing some more help or support. What resources are available to you? Home health companies provide nursing care as well as physical, occupational and speech therapy services. And a lot of home health companies will also provide additional caregiver services if somebody is needing a bath aid or if they're needing somebody to be present with them during the day for safety concerns. If you have a college in your community that has any kind of therapy or nursing programs, you can reach out to them to ask if they have any students who would be interested in opportunities for caregiving for short periods of time, or even staying overnight with a senior if that's a concern that you have. The upside of those programs is they may have already background checked their students, and you're welcome to ask them. Most of them will tell you. And you're also getting somebody who already has some interest and maybe a little bit of skill relating to caring for seniors that could come in handy when helping your loved one. Some states also have additional programs for people with disabilities or senior citizens who are wanting to remain at home independently. In Illinois, there's a program called the Department of Rehabilitation Services, and they could provide caregivers that help with higher level homemaking tasks. And that can be something like cooking, laundry, taking out the trash, or going to pick up prescriptions, or just small grocery runs. Some of those programs, depending on the state, may have income limitations, and some of them require that you have a certain amount of disability in order to qualify for one of those caregivers. You also have the option to hire somebody privately from the community or someone that you find on care.com. Through care.com, I do believe they background check a lot of the people that they have on their site. So you do have that safeguard in place, versus if you hired somebody that you met out in the community, you would have to background check them yourself if that's something that you were concerned about. Also, if you hire somebody through an agency versus privately, they are more likely to provide a caregiver in the hours that they've already promised you would have care, versus if you hire somebody privately and you were expecting them to be at the home during certain hours and they're unavailable to come, you may just be out of luck. You can also check to see if your community has any senior centers or adult daycare facilities, and those can provide opportunities for seniors to get some more social interaction and activity during the day. If all else fails, you can always call your local hospital and ask if they can connect you with a social worker who has knowledge about resources for seniors, and see if you can get connected with somebody that way who can give you community-specific resources that meet your needs. Thank you so much for joining me today to address the concerns of your senior loved one and help provide them with some resources to keep them successful in living at home or as independently as possible. If you are interested in this type of content, I would love for you to subscribe to my channel, like this video, and share it with anyone else that you know may need this kind of information, and make sure that you turn on the alerts so you don't miss a single video. Thank you so much for joining, and I'll see you next time.